talk about sustainability these days, everyone tends to think about environment, economy, recycling and stuff like that. But in the heart of all of this actually is people. Ultimately, all of those things help us to live better, longer lives, right? So that's where we come into play. What we do is about people, about health, and I want to talk about how this builds sustainability in the long run. Jesper very kindly explained who we are, but let me give you some more details. We are a very old company. We are almost 100 years old, and we are globally present. Traditionally, we've been dealing with diabetes and chronic diseases, and these days we are expanding into other areas like obesity. But I'm going to talk about this in a while. We are a Danish company, and we operate with our Novo Nordisk way. So we are present almost in 170 countries, and we are actually the world's biggest, largest protein producer, including insulins. We have production sites in a number of countries, and this puts us actually in the mid-pack when you rank the global companies in pharma. But when you think about diabetes only, we are the biggest company. Now, when you ask yourself what's the biggest, most urgent healthcare problem in the world today, perhaps in the short term everybody would agree that it's perhaps COVID, but there is something else. Well, when I was in my early 20s, I thought I would be an old man when I would be 50. That was the understanding by then, only 25 years ago. I mean, our average lifespans were a bit shorter. The industrialization, the urbanization globally was, still crawling in. And in the span of just 30 years, something strange happened. The world population decided to live in cities. We all abandoned our farms. Then decided to take up a job or join our friends and families in big cities. And that led to something that nobody could foresee. That led to an increase in non-communicable diseases. These are the diseases that you don't get from somebody else. These are the things that grow, that happen as you get older and you live longer. And today, as we speak, actually 74% of global deaths are coming from non-communicable diseases. And these are, there are many of course, but when you think about the four biggest ones, that's diabetes, cardiovascular disease, cancer, and chronic respiratory disease. And that's their order in magnitude. But there is something terrible about diabetes because its number, the number of people who live with diabetes and obesity is increasing at a frightening pace. And as I explained, this is probably due to our lifestyles. We are sedentary, we are not moving, we are eating a lot more than we do, we are getting overweight, and in time, diabetes, type 2 diabetes crawls in. That's very connected to other disease areas like cardiovascular disease, cancer. And we should be doing something about that because now we have vaccines about COVID. But if we don't think seriously about those diseases and make a policy change, then the sustainability of our future will be at stake, especially in countries like Philippines. The increase is frightening. More than 700 million people are today now living with diabetes. And the incidence, the prevalence, and the consequences of this disease is getting worse and worse. So, in a nutshell, let me summarize what I've said so far. We are now living in a world that basically live in cities. When I've been to Manila the first time, 20-something years ago, the city was actually much smaller and the population was not 32 million. Now, if the population continues to grow at this rate, which and it will not, but if the healthcare problems, especially the non-communicable diseases, continue to grow at this pace, then something terrible will happen. A big portion of the population will cross 40, 50 age threshold, and those people, unfortunately, will more often suffer from diseases like diabetes, and they will have to spend their time, energy to invest in, therapies, and that's not sustainable. If today we have 700 million people living with diabetes, that's more than some countries already, most countries actually. If you double that, then that's like 1/4 of the world population. So no government, no healthcare system in the world can sustain that kind of health problem. We should do something about prevention, and it should be done today. Now, this is our purpose as Novo Nordisk. Our purpose is to drive the change to defeat diabetes and other chronic diseases. And it's interesting because we have been doing this for a very long time. Our main product has been insulin, and insulin has been found 100 years ago. And our firm was founded just 2 years after that. And all this time, despite all the efforts, this pandemic of diabetes has been growing nevertheless. So I've already mentioned about our global presence. In Philippines, we've been present for almost 40 years now. In 1976, we started making our products available through a distribution agreement. And since 1999, we have our own operations. Now, we are working on 3 fronts. One, we are trying to build the awareness so that people are aware that there's diabetes and obesity and other chronic diseases. Second, we work to ensure affordability and accessibility of our products. And third, we bring in innovation so that the patients get better therapies. Well, let me mention you a couple of initiatives about how we support or try to support accessibility. If you go to a Mercury store today and buy a pen of insulin, I'm not going to quote you prices, or maybe I should do that to put things in scale. 1 pen of insulin costs on the average somewhere between 600 to 2,000 pesos roughly. And globally we have a program which we call Insulin Affordability Program, and we make a commitment to provide our first generation insulins for $3 per wheel for government accounts, for government systems. That's almost like 150 pesos. Now, you all read in the newspapers that our government is trying real hard to make universal healthcare a reality. And I hope we all succeed in doing this. And this is where we can play a role by making our first generation products affordable to a larger population of people so that everyone gets treated. That's one, but not the only one. Second, we founded World Diabetes Foundation in 2002. In short, that's a foundation that supports awareness, accessibility, development and research projects about diabetes globally. And so far, we've funded 571 projects, including the ones in Philippines. I already mentioned you about our access to insulin commitments. And we also have a program called Changing Diabetes in Children. There are 2 types of diabetes, type 1 and type 2. Type 1 develops early on in adolescents and children, and those children cannot live if they don't have access to insulin. And our program makes sure that in developing countries, a certain group of children has access until they grow up. And I'm proud to tell you here that Philippines is within the scope, although we don't have started the project. So finally, Philippines is a disaster country, I'm afraid. A beautiful nature comes violently. We have volcanic eruptions, typhoons, earthquakes, and unfortunately we have to live with those realities. We also partner with other NCOs to make sure that we are there to help when disaster strikes. So my part is here over. Let me briefly summarize. So I think we all need to make sure that when the COVID crisis is over, even today, everyone around us are educated and aware of something called diabetes, which could affect the healthcare of individuals, sap into the resources of families, nations, and I think that's extremely important for Philippines. And this is our reason why to be in Philippines.
In my section of the talk, I'll just again considering the Friday mode, I will try to be as least technical as possible. On the other hand, touching on the important aspects that we are doing as well. You have heard the big challenge that our society will be facing or is facing with diabetes and obesity. Some call it the silent pandemic, and this is not a statement that I'm making now, but this is what the scientific community has been talking about 5 years back, that obesity as such is already a pandemic in the process. As a company, we have been continuously innovating to bring new treatment options to our patients. These options are path-breaking as such or trend-setting in a way, and we see that being adapted into new guidelines, and how the treatment approach towards obesity and diabetes being shaped by the innovation that Novo Nordisk as such is bringing in. However, making affordable medicine or even innovative medicine is not enough. When we see the staggering number of diabetes patients, it is obvious that we need a lot of doctors being trained on how to manage this condition. Not just doctors, this load will also come on the various associated healthcare providers that are there. If you look at diabetes management as such, only half of the patients with diabetes are actually diagnosed with the disease. That means the other half do not even know that they have a disease, and they present at a very later stage with complication to the hospitals. Among the half that know that they have a disease, only 50% of them actually reach the target or treatment target that they have agreed with their doctors. That means there is unmet need in every step on awareness, and mainly also on the accuracy of care, be it at the HCP level, at the doctor's level, or at the level of the patients. One of the most important contributions to reduce this unmet need is updating our doctors about the new treatment guidelines and innovative treatment options that are available to most of our patients. What we provide, and again in my talk I'll just put a light on few of the aspects that we are doing amongst many, and one amongst them is providing a platform for our doctors to gain knowledge and exchange their clinical expertise in order to fine-tune their approach to help manage the patients with diabetes. A very practical example is the current pandemic, in which we were able to bring expertise from all parts of the globe to exchange their knowledge with Filipino doctors and to mutually learn how this disease impacts patients with diabetes and obesity, and to deliberate the best possible approach for managing our patients. I'm sure you would have been very familiar with the first wave, in which anyone having co-morbidities, especially diabetes and obesity, were at a larger risk of worse COVID infection. So these events or these activities that we do might cater to a small group of doctors, but we are also thinking big. Again, from a sustainability point of view, what we have also committed is to partner with leading universities or associations to bring education freely available to most of the doctors, especially in the field of diabetes and obesity. And what you see on the right-hand side of the slide are the various options that are available to Filipino doctors that they can access for free and update their knowledge on the most innovative medications or the newer approaches towards diabetes care. So that's about educating our doctors or healthcare professionals. But the bigger chunk is all about the patients who go through the disease or who manage the journey of the disease. So awareness is the other big contribution that we are doing to improve, as such, the focus on diabetes. If you look at a recent survey that was conducted, I think it was conducted in more than 8 countries, which included over 10,000 patients and 2,000 doctors. And the question was about how do they look at obesity and how is obesity being managed. And one glaring evidence that came out was a patient takes around 6 years even to bring the question about obesity management or to accept or to ask that question, can I do something for my obesity, with the doctor. We are talking about obesity, which could be a very glaring problem. Think about diabetes, which people do not know to a larger extent until and unless they are accidentally finding it out, or some of the complication makes them go to a doctor. So there is a huge amount of gap in patients' knowledge about what a disease is and when should they reach the doctors. And if you are able to fast track that part of the curve, if they are able to reach the doctor early, then the complications that they have or the problems that they have to live with the disease will definitely reduce, overall contributing to a better quality of life rather than to go with suffering for a long period of time. So in order to bridge this gap locally, I'm sure all of you are familiar with the penetration of Facebook in Philippines, and we have created this initiative locally to have a platform in which patients can directly connect to the best experts that are there in the country to talk about their disease or talk about how to manage their disease and so on. So we call this as Kalingang Novo Nordisk. So this happens every second Friday, and there is one today evening as well, where we have experts in the field of diabetes and obesity talking about self-care, talking about disease management, talking about what are the red flags that patient needs to be aware of, whom they can reach, when they should reach, and so on. I think this awareness activity, the reach of this is something that we are still understanding to what an extent can impact a patient's life. We see a lot of responses from the patients as we go during the meeting that this is something that I did not know. I've been having diabetes for such a long time. I did not know about such a simple thing. So awareness is again a very crucial thing in the overall picture to contribute towards solving or making even a dent in the large problem of diabetes. So we've talked about doctors' education, we've talked about patient education, but the important part remains, what about the patient who already are on various medications or who are already going through this journey of managing their chronic problems such as diabetes or obesity. So this was something that was daunting to us as well, and hence we have come up with this Educare service, which is a patient support solution that helps patient in every step of their journey on managing diabetes or obesity. Can we go to the previous slide, Jackie? Yes. So what this Educare provides is, first thing first, it provides an hotline number that the patient can reach to discuss about their disease, to get some psychological support, to get some to speak and understand what diet they should follow, and so forth. And these hotlines are manned by trained nurse educators who are very happy and are available to take these discussions with the patients on a one-to-one basis. When we were initially having this service, even with the physical presence all across the country, but with the pandemic coming in, I think this was a kind of a blessing in disguise, so that most of our patients could reach these nurse educators even via a Viber call and understand how to use the various devices for managing their condition. It could be an insulin device or another therapy device, and they could connect to these nurse educator to manage their psychological aspects related to the disease as well. Along with this, we have a series of digital offerings that would help the patient get all the information at their fingertips, and all of this is again connected back to the educare team to have a human touch. So as I shared before, these are a few of the various initiatives that we have planned to at least make a dent to the growing problem of increased diabetes and obesity within the country.
So we've talked a lot about how we are helping and addressing the need, yet we are not stopping there as a company. Yes, insulin has been discovered for the last 100 years, and that alone paved the way for a lot of innovations to happen, so that having diabetes is not a death sentence anymore. However, we also, on the other hand, we also are looking at how do we actually prevent diabetes from happening in the first place. So that is the bigger part of our ambition, where it's a bold ambition, but that's where things happen. Of course, we're not yet there. We never know when, but this is no longer a question of how. It is already a question of when. When can we actually prevent diabetes? And so prevention is also critical in the whole process. Now, prevention to cure, and we've already shared with you some of the measures and some of the contributions that we've made in as far as cure is concerned. Now, in prevention, how do we actually kickstart this, or how are we playing in terms of prevention? So we have here, it's a program called Cities Changing Diabetes. And so far we have more than 35 partner cities around the globe. And we know for a fact that most of the, diabetes cases are centered or in the urban cities across the different countries around the world. So we tried to partner with key cities to try and address how do we actually change diabetes within the locality. Of course, we want to start it as well in the Philippines. So very soon, hopefully, we can also identify a city to partner with in driving this particular program. So this is where we ask ourselves, what will it take to bend the diabetes curve in our cities? So this is one of the key projects that we really, or initiatives that we also want to work on, and as far as our country is concerned. And then we also have, of course, we know for a fact that having an obesity or having diabetes, there are a lot of complications. There are a lot of comorbidities as well with diabetes. But one of which is, and a great source of that is, being overweight or having obesity. So globally, we've worked together with UNICEF to prevent childhood overweight and obesity, to address that part, because we know that when you have obesity, or at least your child has obesity, and it has not been addressed at the onset, there is a big possibility, or that will lead to having diabetes later on in his or her life. So talking about prevention, yes, it's critical to look at what is the root cause of having diabetes. One of the root causes of diabetes is actually having obesity. So this is also a critical partnership that we've made globally, and hopefully pretty soon we will also be able to launch and include Philippines in the map of this project. So all of the things that has been discussed so far leads us to how do we make our company sustainable, and not just for the future of sustaining the business, but more so how are we contributing to the society and the environment in general. So we've talked about our own values, the Novo Nordisk way, and each and every employee of this company knows and live by those 10 essentials, where we all know that describes who we are, where we want to go, and the values that we have to portray or that we have to live by every day in order for us to do, to be a Novo Nordisk employee. And what's critical in one of those essential is our triple bottom line. So for us, it's really important to be socially responsible because that actually covers how our impact to the lives of people in the society. So hence, we are also trying our best and putting in our ambition, the high ambition of Novo Nordisk, to defeat diabetes and obesity and other chronic diseases that are out there. And that we feel socially responsible for. We're also looking at, of course, financially, where do we really, invest our resources and make sure that this all went to, of course, research and development and making sure that we are at the forefront of addressing diabetes worldwide, and also contributing to the environment. So that's where our environmental responsibilities is taking place. So all of these we try to balance because we know that impacts can be negative and positive. And yes, creating materials that are made of plastic actually has a negative impact, and we're not proud of that, but we're doing something about it to make it a positive impact eventually. And that's where our environmental responsibility comes in. And so we try our best to balance these three and make our decisions based on how we will have a positive impact in these three aspects. No? So in relation to the Sustainable Development Goals, which were of course agreed upon by world leaders in September of 2015, we are extracting SDG number 3 and 12 as our priority in the country, in our business, because of course we want to address the good health and well-being of the people around us, including sustainable cities and communities. Hence our initiatives mentioned earlier, and also our contribution to the environment. Now, to summarize what has been discussed earlier by Sir Dar, our Defeat Diabetes Social Responsibility Strategy covers prevention, access and affordability, and innovation. So that's where all of these comes in. You see the big picture, you kind of look at what we are really focusing on, because we know that that's where our positive impact will come, and the impact will be there. So that's our key priority for the company. And then speaking of the environment, of course, the zero environmental impact is our ambition. By 2030, we want zero impact on our carbon emission. So far, what we have achieved is our 100%, the materials that we make, the products that we make are 100% sourced from natural material and natural energy. So, and we're not stopping there. No? So it's a long journey, and we're aiming for a zero environmental impact in 2030. But we've already started. We've already begun, and we're not stopping. So, and let me just end this now. So we've talked about our social responsibility. We've talked about our environmental responsibility. So let me end this conversation with this team. So this is a global team composed of all of them have diabetes, and this is the first ever all diabetes professional cycling team. And the mission is simple, to inspire, educate, and empower people affected by the diabetes. Of course, each one of them, even before the discovery of insulin 100 years ago, having a type 1 diabetes is already considered as a death sentence. You're just gonna wait when you die. But because of that insulin discovery and the rest of the innovation that came after, we're here and we're looking at these athletes, those that have diabetes, they are living their lives like there's no diabetes. And that's the kind of message that we want to give, that right now, when you talk about having diabetes, it's no longer about, am I going to live long? It's about how do you live your life to the fullest and be as normal as you can be. Because there are a lot of organizations, there are a lot of people that are willing to help and contribute to make sure that diabetes and the obesity and other chronic diseases will be addressed and will be eradicated eventually at some point in our lives.